So today we're going to be working with a patient who has Achilles and posteromedial ankle pain due to running for long periods of time. So today we're going to be choosing 6 different exercises in the beginning, in the middle, and toward the end that could help the runner patient get back into the sport again and to increase stability and to decrease that pain that she's feeling in the ankle area. So the first exercise we're going to be doing is going to be a side lying hip abduction to work a little bit on the hip abductors because we know that there's decreased strength in that area. Okay. So what I'm going to have you do is you're going to be laying on your side over here.
Do you want to head on this side or that side?
Let's do head on this side. Okay. So from here, and what you're going to do is I want you to go ahead and bend your right ankle, or not ankle, leg for me. And from here, all you're going to do is bring this leg up to about this position. So we're going to be working our hip abductors, and then we're going to bring it back down. And we're going to do that for 12 to 15 repetitions. Okay. And we're going to do that 3 times after inserting rest breaks in between it, okay? So from here, go ahead and bring it up, and then hold it right there and bring it back down, nice and controlled. Nice. Bring it up again and bring it back down. Any pain or symptoms with that?
No.
Okay, good. Can you point to where you feel that?
Right here.
Okay, good. Okay, one more time, and then we're going to assume that you did 12 to 15 repetitions, and then we'll do that 3 sets. And then after that, we're going to switch over to the other side and repeat that, and that will be the end of the first round, and we'll do that 2 more times.
Okay, how many times a week am I doing this, you said?
You're going to be doing this about 3 to 5 times a week to work on the stability of your hip abductors.
Okay. I'm going to start with some simple exercises just to get you moving again to build up to that progression. So first thing we're going to start with are ankle mobs. And so what we're going to start with, your ankle is going to be in this band. I'm just going to demonstrate it as I talk. So you're going to put it right around the talocrural joint, which is your ankle joint. And so you're going to be half kneeling. You want some tension on this band so you get some good tensions on your tibia. So what you're going to be doing, you put a hand here if you want for stability, and we're going to be going back or forward and back, forward and back. And we want to do about 20 repetitions for 3 sets. Do you have any questions?
No, that sounds good.
Okay, so you can put your foot in here. Good. And then you want to make sure the band's behind your shoe, a little bit down. There you go.
Okay.
And then you're going to go in half kneeling. Good. Do you have some good tension on that band?
Yep.
Okay, so you're going to go ahead and lean forward. Good. And lean back. How does that feel?
Good.
Good? All right. Again, we're going to do probably about 20 reps of that for 3 sets. Awesome. Good.
How many times do you want me to do this?
We'll probably do that 5 to 6 times a week just so you can get the bones gliding and to get that range of motion back.
Sounds good.
Okay, now that we're in the middle of your progression, we're going to start amping up your exercises. We're going to work more on endurance with this exercise. So what you're going to do, you're going to be half kneeling again, but this time you're going to be in a lunge position. You're going to elevate your front foot, so you're on your forefoot, and you're going to elevate your back knee. So you're going to be holding a lunge.
Okay.
You're going to be holding this for 20 seconds, so you can work on that endurance of your calf or your gastroc and your soleus, and to work on your stability of your ankle. Okay. We're going to be doing this 20 seconds for probably 4 sets, and we're going to do that probably 3 times a week.
Okay, sounds
good. So go ahead and go down on your knees, face this way. Good. And then you're going to elevate your front heel and elevate your back knee. Good. Make sure to keep that chest up. Just hold that for 20 seconds. And we're good there. So we'd hold that for 20 seconds.
We're going to do next is a little bit more of a progressive exercise, and it's called heel raises, but we're going to add a little bit of a isometric, concentric, and eccentric movement to it, so that way we can work on that ankle instability and as well as to build endurance in that region, okay? So what you're going to be doing is you're going to be stabilizing yourself on top of the box. From here, you're going to do 1 side at a time, and you're just going to have about 1/3 of your foot that's working on the edge of the box. From here, what you're going to do is you're going to go ahead and press yourself up. In 2 seconds, you're going to count 1, 2. Hold yourself up there for 5 seconds. So 1, 2, 3, 4, 5. And then slowly lower yourself back down in 2 seconds. So 1, 2. So again, you're going to go up 1, 2, hold 2, 3, 4, 5, and back down 1, 2. Okay. And you're going to do that on one side focusing on that motor control, about 8 repetitions. You're going to switch to the other side and do that 8 times as well. Okay? And because I want you to focus on motor control, we're going to do that quite a bit amount of times. We're going to do that about 4 times on each side. Okay? And then we're going to focus on that daily so that we can go ahead and make sure that we get you back into that race. So from here, you're going to start on top of the box, and then you're going to bring one foot about 1/4. And from here, I want you to go ahead and push up 2 seconds. 1, 2, hold, 2, 3, 4, 5, and lower 1, 2, and repeat. 1, 2, hold, 2, 3, 4, 5, and 1, 2. And then you do that 6 more times, and then we'd switch over to the other side and repeat.
Sounds good.
Any questions?
Nope.
Okay, good. Right. So now that we're heading toward the end of the rehab phase, we're going to work a little bit more on power production and endurance, so that way we can replicate a little bit of what happens during when you're running in the marathon. So what we're going to be doing is we're going to be doing a reverse lunge into a plyometric knee drive, or into a plantar, focusing on the plantar flexion component of that jump, so that way we can strengthen our gastroc and we can work on that explosive force, especially when it comes to running. Okay, so what you're going to be doing is you're going to be going to reverse lunge on one side, coming all the way back, making sure that you're in an upward position. And from here, when you knee drive, you're going to jump up with the other side, focusing on pressing your toes and your forefoot into the ground, jump up. Okay? And again, it's going to test your instability, or your balance and your stability, because you're going to have to land with good landing mechanics and making sure that you keep yourself upright. So essentially what it'll look like is this. You're going to reverse lunge, push up, and then back into it, reverse lunge, push up again. Okay. For that, we're also going to do 8 on, actually not 8 on each side. We want to focus on the endurance components. It's going to be 20 repetitions on each side. We're going to do that about 3 sets, so 20 times of 3 times on each side. And we're going to focus on that 3 to 4 times a week to work on that power production.
Okay.
Okay?
Yeah.
Any questions?
No.
Okay.
You got it.
So from here, you're going to reverse lunge on one side, and then drive knee up and explode, focusing on that plantar flexion, and repeat. Okay, do 2 more for me just so we can see what it looks like. Good. So again, we do that 20 times on each side for 3 sets, about 3 to 4. You feel it? Nice.
All right, so now that we are on your final stage of your progression, we're going to do some more plyometric exercises. So for this one, if you could take a step back for me, please. So for this one, we're going to do single leg bounds. So you're going to start on one leg, here, up, down, and when you land on that leg, I don't want you to land stiff. I want you to absorb that shock and go down with it. That's working on your ankle stability. Then your explosive leg is working on like when you're running, so you could explode. Okay. So up, 1, 2. You could reset if you need in between, and then other leg.
Okay.
So we're just working on the shock absorption, the stability, and the explosiveness.
Okay. So here, I'd start in this position.
Yep.
And
down, explode up.
Land.
Yep.
Then up, land.
Yep. And then we'd probably do that for probably just 8 repetitions. Well, 4 repetitions each leg for each round. We'll probably do 4 sets.
Okay. And then do you want me to focus on the height of the jump, or the how far forward I jump?
Okay. I want you to focus on the explosiveness up,
okay,
so we could work on the strength of your calf.
Okay. Sounds good.
All right. Good. Any other questions?
No.
Good.